Welcome to Doctor's Housecall. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening. Mike Farrell here with you, the moderator, and good evening to Dr. Gear.
Hello, Mike.
And Dr. Wyrick.
Howdy, howdy.
Hey, they're coming into your home. That's why we call it Doctor's House Call. If you have any questions, call us at 474-2427 about maybe what's bothering you. How's your balance? Have you noticed? As a matter of fact, I read something the other day that one of the first signs of aging at around the age of 40 is having a little problem with balance, having less control on your balance. Now, doctor, is that true, about 40 for the age?
Yes. What happens is people's injuries in childhood, teenage years, early adult life, and people say, oh, I was never injured. Oh, yeah, almost 100% of the people have been injured one way or another. Causes a problem with circulation of blood flow into the spinal cord, and that affects the brain function, because the brain and spinal cord are all one piece of organ. They're all one unit. So you have to have good blood flow throughout the brain and spinal cord in order to have good sense of balance.
Okay, I think, the first time I noticed it was when I got up in the morning and went to put on my pants and lost my balance. I mean, I used to be able to do that without sitting down,
Was that about age 40?
No, I think it was more like 50 or so, but all of a sudden I realized that it was a little more difficult to do that. And I read an article that said you can work on that. You can you can do an exercise by standing on one foot, for example, while you brush your teeth. And,
well, it's reprogramming the central nervous system is what you're talking about, right?
And just looking at a certain area and keeping your focus on that while you stand on one foot or whatever. I found that helped a little bit, but when I really had a balance problem, I went to you for help, and you did an adjustment on my neck, and the blood flow had been, compromised because of my neck not
you had
the right
some pretty
adjustment.
bodacious injuries in the past.
Yeah, and that you certainly helped me a lot there. So, like you're saying, spinal, cranial manipulation can get that unrestricted blood flow going to the brain. That's very important.
Right. So proper balance is a combination primarily of three things. One is your eyes have to focus on something. Two is the little semicircular canals in the ear inside the head. They're called the labyrinth. They have to get proper blood flow so that the fluid inside of them can orient itself to gravity. And then the third thing is what we talked about first, which is the nervous system, all the way from your feet clear up to the top of your head, orienting you in relation to gravity. So that's those three primary factors there involved in being able to stand up straight and without falling over. Well, I'll tell you, one time I had an experience personally on Boy Scout hike over at Catalina Island with my two sons. I got in the water over there in the ocean, and I got water in one ear. Now, Mike, you had an experience with ears recently. When I got water in one ear, I tried to stand up. I fell over sideways. I could not balance. I could not stand up.
It's a horrible feeling, isn't it?
It is. It was terrible. I had to get the water out of my ear and get the temperature back up to equal on both sides. And then I was fine. Now, you had an experience not too long ago where we found you had some wax in your ears.
Whole bunch of wax in my ears. Yeah. And that was causing my balance problem at that time. Yes.
Right.
So had to get that cleaned out. And
It took a while to get it cleaned out completely.
yeah, because it built up over such a long time.
Right.
You know?
Right. I think you were growing potatoes in your ears.
Yeah.
You remember that old saying, had so much wax in there, you're growing potatoes?
Right.
I heard that from my grandparents back on the farm in Missouri. People get wax in their ears all the time, and the reason for that is it has to move debris that gets into the ear canal out of the ear canal. So that's why it's sort of a waxy exudate. However, if it's too thick, it stays in the ear and it builds up. And when it builds up enough, it blocks the ear canal. And then you don't have hearing properly in one ear compared to the other one. Now, if it's just one side and not the other, we know there's a neck problem. If it's both ears, we know it might be a gut problem. And Dr. Wyrick's here to talk a little bit about gut problems and how they affect the hearing because of the circulation into the sinuses and even into the ear itself. Dr. Wyrick, you want to mention a few things about that?
Well, yeah. When we talk about problems with the ears, very often it's food allergies that are the problem. And we have a test for that. But especially if you have a young child that has otitis media all the time, really think seriously about looking at their diet. Common culprits are eggs and dairy that cause considerable mucus buildup in the sinuses, which can affect the ear.
Dr. Wyrick, what is otitis media?
It means inflammation of the middle ear.
I see, and that occurs because the eustachian tube, that's the tube that connects the middle ear to the back of the nose in the throat, called the nasopharynx, gets plugged up.
Yes.
Because of congestion in the mucous membranes, because of almost always a person eating or drinking some kind of quote-unquote food that is not right for their body.
Exactly.
And that causes this reaction, this IgG reaction. I lived that as a child, unbelievable headaches and sinus problems and mucus, and it was terrible. And my parents didn't know that I couldn't have cow's milk. So I was given cow's milk, and finally, after my tonsils got cut out because they were growing together in the back of my throat, they switched me to goat's milk because my general practitioner said, oh, let's try them on goat's milk. And the inflammation reduced. Didn't go away, but it reduced. So and test is so vitally important in children. You know, we had a young boy here about a year ago, came in with his mother, and she wanted him tested on this IgG test, and so we did it. He had 25 foods at 9 years of age that he was making antibodies toward. And it was causing him to be hyperactive, attention deficit disorder, lots of difficulties. It was like putting gasoline on the fire. So getting back to balance now, vertigo, the feeling that you or things around you are spinning, that's a pretty common symptom, and a lot of people get that way when they get drunk. Dr. Wyrick, why do they get that way when they get drunk?
Honestly, I'm not sure.
What it causes is poisoning of the body, and it interferes with circulation in the brain itself, and there's also a utilization of B vitamins to neutralize the alcohol, and the whole effect is a poisoning effect in the brain.
It depletes the glutathione system, which is the master antioxidant in the brain.
I knew if I primed you, you'd come up with the answer on that.
That's why I guess when they pull you over, they make you do a balance test, right?
Exactly.
Where you have to, walk and balance and put one foot in front of the other because they know alcohol affects your balance.
It poisons the nervous system. And, it's terrible. I used to think that it was fun to get a little bit drunk when I was a teenager and as a young adult, but I haven't touched that stuff since I was 32 years old. No more. I decided I didn't need to poison myself anymore. My age 30s was a learning experience for me. I quit drinking alcohol, I quit smoking cigarettes, I quit eating red meat from a cow, and I found out that I have a lot of these problems with my food Igg testing that had I been able to have that test done when I was a child, my life would have been so much better because I wouldn't have had all this stuff coming from my intestinal tract that was terrible.
It's the old saying, if I knew I was going to live this long, I would have taken better care of myself. But, yeah, if we knew all these things when we were growing up, we probably wouldn't have made these kind of mistakes.
Every child, and this is a real statement now, every single child needs to be tested to find out what foods are foods for them and what foods are poisons for them. And then they need to be on that kind of a diet where they don't have this thing that causes them to be malfunctioning in school so that they get better education. I was just listening to some researchers here just a day or so ago talking about the ability to change genetics in people in the womb and reorganizing the human race to get rid of all of the defects and make us into perfect human beings.
Yes, I've read some about that. It's a very high-risk strategy. Basically, it's developing special viruses that actually attack our DNA and replace our DNA with substitute DNA. So this is the same principle as genetic modified foods. And doing it on a human where if it goes wrong, it's a big problem. It scares me.
Well, we're not going to be able to change it because you and I are not going to be alive at that time. However, it's interesting to see the science. Do I agree with it? I don't really agree with it. I think that we need diversity. I think that's what we have. That's what was built into this earth in all organisms.
Now, there is a similar technology that's being developed that I like very much, and that is the science of epigenetics, where instead of changing the genes, we, through nutrition and other interventions, nudge the actual gene expression on or off.
That sounds like naturopathic medicine approach.
Yes, it is.
Exactly. Something that my aunt started teaching me when I was 6 years old. Interesting, isn't it?
But it has a fancy new name.
It is. It's a lot of science behind it now. And before it was just we knew to do what we knew to do because it was right. Now it's changing. So if you notice a spinning sensation, or you're falling or feeling as if you're going to fall, or you're lightheaded, or faintness, or a floating sensation, or you have blurred vision, or you get confusion or disorientation, those are some of the symptoms that people have on balance disorders. They feel unsteady. If you have nausea, vomiting, diarrhea, changes in heart rate and blood pressure, or you start feeling fear, anxiety, or panic, those symptoms may come and go over a short period of time or last a long time. It leads to fatigue and depression. Dr. Weyrich, how many of our patients have all those symptoms, or a great many of those symptoms?
Fatigue is endemic in our patient population.
Well, we see a lot of people who have gastrointestinal problems, and that often is due to bad diet because they didn't know what a good diet was. It's also due to old injuries that they had, and they didn't know how that was affecting them. I had a lady come in just this last Sunday, 2 days ago. She drove up from Phoenix. She was dizzy. She didn't feel right. She just was kind of out of it, but she drove up anyway. I said, why did you drive up? She says, well, because I knew you could help me. So I treated her Sunday, examined her and treated her. And it took me probably 5 minutes, 6 minutes, and I straightened her right out because I knew her spine and I knew her body pretty well. And she didn't have the dizziness anymore, and she felt really good. Then she went home, and I talked to her later. She said, oh, I'm in the hospital now. Well, on the way home, she ate a whole bunch of dried cherries because she was feeling so good. And she got a gut problem, and it started making her hurt like it was a heart attack. The examination showed that she did not have a heart attack of any kind, nature, shape, or form, and her problem was entirely due to overeating the dried cherries. Isn't that interesting? So we got her to change her diet a little bit now, straighten herself up. It's really important to pay attention to what your body can and can't do. So if you feel unsteady, or you feel as if the room is spinning around you, even if it's for brief periods, or you feel like you're moving when you know you're not, you're standing or sitting still, you're afraid you're going to lose your balance and fall over, or you feel like you're falling, or you feel lightheaded, like as if you might faint, or your vision becomes blurred, or you ever feel disoriented, or you lose sense of time, place, or identity. You know, those things are all like a person's drunk, isn't it, Dr. Weyrich?
Many ways, yes.
And that means poisoning of the brain. The brain's not getting good blood flow. So if you think you have a balance disorder, you need to schedule an appointment with us. We could refer you to a specialist, but not until we've had a chance to look you over and see if it's some simple problem. You know, I had a woman come in this afternoon who had pain in her heel, right at the bottom, where it's called the plantar fascia, attaches to the heel bone, the os calcis. And she put her finger out and said, it hurts right here. Well, in my experience, I asked her, is it tender where you're touching? She said, no, but it hurts there when I walk. So it's not tender, but it hurts there when she walks. Aha. It only hurts when I sit down. It doesn't hurt when I'm standing, and it goes away pretty quick if I'm walking. But it hurts when I sit all the time. So I looked at her and I says, well, I think your problem is coming from your upper neck, right under your skull. And she says, what? How could that possibly be? Well, I learned many, many years ago, 60 years ago, that a whiplash injury can cause a person to have a pain right in the center of the bottom of the heel of the foot. And it's coming from the first and second cervical vertebrae being twisted, affecting the blood flow into the spinal cord and the tract of nerves that comes from the heel up into the brain. So I checked her neck out, I adjusted her, and within a few seconds, that was corrected. I had her get up, go sit down in the chair. She tried to find the pain. It wasn't there anymore. Then she said to me, oh, but my arch is hurting. So I said, lay down again. So after I had her lay down again, I said, it's probably coming from your abdomen right here. Remember that, Dr. Weyrich?
Oh, yes.
I pushed right on her belly, and it was sore. And I touched her arch, and I could feel the relaxation in the arch muscle as soon as I touched the belly spot. Now, you mentioned to me that's an acupuncture point.
It's on the what's called the stomach meridian, which starts in the foot, goes up the arch of the foot, up the leg, and about 3 inches lateral to the belly button, all the way up the abdomen.
And that's exactly where the pain was at. When I touched it, it was between the descending colon and the sigmoid colon junction area. And so she was a little inflamed there, so by pressure on it, caused it to relax a little bit, and that stopped the arch from hurting. And then we talked to her about the necessity of eating correctly. and if she didn't want to have pain, that is. Of course, if you want to have pain, you can always eat improperly, but most people don't want to hit themselves in the head with a hammer.
You know, doctor, I have experienced dizziness and balance problems, and I don't think they're related. In other words, dizziness, in my opinion, is when the room is spinning. You know, you wake up in the morning or go to bed at night, you look up at the ceiling and everything is spinning. Balance, on the other hand, is you get up and you have trouble getting your balance. It's not a matter of the room spinning. It's just you don't have balance.
Right. So spinning, when you get, like you just mentioned, that's brain not having good blood flow. And the balance is either the nervous system that we've been talking about or the vision coordination or the inner ear. That's balance. That's why you are able to be against
So
gravity.
are they related?
Not really,
Okay.
except for the fact that the brain tissue is involved in both. But one is circulation, the other is a mechanical circulation problem or a digestive problem. The other is a problem like an infection or a poisoning, where the brain itself can't orient itself properly. So those are things that require a little bit of background in medicine and a little finesse to understand the difference between the two. And when we see a patient that comes in with that kind of problem, we can do some testing and evaluations, and most of the time we can find it pretty easily. If we can't, then we have specialists that we can send people to. An otolaryngologist, we'll try and say that one a couple of times.
A what?
An otolaryngologist. That's a doctor that goes in the nose, the larynx, the throat, that's
and
a
the ears.
specialist. And the ears, right. Ear, nose, throat doctor. And so they have some special tests for that. But we do a neurological evaluation in our office. I have Dr. Wyrick do that for me in the office. It's a 8-page exam that we do for structural problems, neurological problems. And then we have the myovision testing for the muscle nerve function in the neck as well as in the back. And Dr. Wyrick, you remember all those tests for balance? What, Knopfsinger's test, and what are some of the others?
I'm drawing a blank as to the name of the test, but there's a whole variety of different ways to test balance, where I start by having the patient stand close to my examining bench, so if they fall, they have someplace to fall safely, and just close your eyes and stand there, and I look to see if they wobble. And if I can't make them wobble with closing your eyes, I say, okay, now keeping your eyes closed, pat your head with one of your hands and see if you can do that. And if they can do that, I have a special foam board that they can stand on that wobbles a little bit. And I say, keep your eyes closed, stand on this. How are you doing? And I'm carefully guarding them. And so there's different ways to challenge that. And it's very important for people as they age to keep track of the status of their balance. And if it starts to get off, intervene, because falls are deadly to our seniors. And anything you can do to improve your balance is going to reduce your risk of falls.
And not only that, but the sooner we get to the problem, the easier it is to fix and the faster we fix it. The longer you let it go, the more difficult it is, and sometimes it gets to the point where we can't fix it. So it's very important to get to it right away, not wait.
Want to remind everybody, as you're listening, if you have any questions, give us a call at 474-2427, whether it has to do with balance or anything else that's, a symptom that you're having. Give us a call, 474-2427. If you're out of state, that's 928, area code 474-2427. So, doctor, the problem with the balance, is this something that starts slowly and gets worse, or is it something all of a sudden you wake up one day and you realize you have a problem?
Yes.
Yes and yes.
Both.
Yes.
Okay.
So, very interesting that about 15% of American adults in 2008 were determined to have a balance or dizziness problem. That was 33 million people.
Wow.
And they can be caused by many different conditions, medications, or problems in the inner ear or the brain. So it can profoundly affect daily activities and cause psychological and emotional hardships. We have a caller. Hello, caller. You're on the air. How can we help you? Hello, caller. Caller, are you there? Nope. Okay, we'll call back, caller. Okay, we'd love to have you call us and talk to us. So if you've ever felt dizzy or lightheaded or the room is spinning around you, those are troublesome sensations. And you say, oh, well, it'll go away real quick. But if it happens very often, it could be a sign of a real significant problem. And you don't want to let that go on. You just don't want to let that go on. So our caller has returned. Hello, caller, you're on the air. How can we help you?
I want to know the name of the gentleman that's talking on the program on KMOG and his office number. Would he please announce that so that I could call them? Who is the doctor?
The person who's talking on the program is Dr. Gear. The phone number is 474-7409. That's his number at the office. Is that what you needed?
Yes, I'd like to call to make an appointment.
Great.
Okay, and Dr. Wyrick also is here.
Yes. I do more internal medicine, and Dr. Gear does more structural medicine, but we're sort of like Jack Spratt and his wife. Twixt the two of us, we take care of just about anything.
Well, I'm interested in the balance thing. That's
Okay.
what I have an issue with, and I understand he may be able to help with that.
Yes. Start with Dr. Gear.
Okay, thank you so much. 7409, right?
Yes.
Thank you very much.
You're welcome. Well, that was a very nice, caller.
We probably should mention that more often.
Yeah. So balance problems are among the most common reasons that older adults seek help from a doctor, just like this lady that called. They're often caused by disturbances of the inner ear. Vertigo, the feeling that you or things around you are spinning, is a common symptom. Good balance means being able to control and maintain your body's position, whether you are moving or remaining still. So good balance helps you walk without staggering, get up from a chair without falling. Remember, we used to have one of my staff here, Andy. He was a retired lawyer, worked with me in my office as my medical assistant because he wanted to. And he came to me on a referral from his wife, and his wife wanted him to get some treatment because he was having some problems. And he said that the biggest thing that got to him was that his granddaughter said to him that it was because it was difficult for him to get out of a chair. He was an old man, and he didn't like that. He wanted to be able to pop right up and out. But he couldn't do that until after we treated him. And we got rid of some of those kinks and those jams. Mike, you've been there. You know what that's all about. Getting your body to where it's functional again.
Yeah. Now, there's two things where you're not talking about balance of getting up out of a chair, are you? Or you're talking just about stiffness?
Yeah, in Andy's case, it was all stiffness. However, he did have some issues that were later corrected with a procedure that he had to have done on the brain. But that was a separate issue. So, if people feel like they're going to fall over, it could be weakness in the leg. It could be that they're not spatially oriented. When I say spatially oriented, that means knowing where you're at in a room. Something that most people don't equate to all this is when you walk through a doorway, does your shoulder hit the doorway, the wood?
Oh, yeah, that happens to me all the time.
That's not knowing where you are in space. That's hand-eye coordination. That means you have to have better blood flow. And Mike, in your case, we're still working on your spine from those old injuries you had. That doesn't allow you to have full blood flow into your spinal cord that helps you know where you're at in space. So that's very important to keep working on that. So spatial orientation, not just consciously, but body-wise, so that your body knows where it's at. I had an injury to my neck that caused kind of a little bit of an injury to my nervous system, and right after that, my vision was impaired a little bit on the right side, and I started hitting my right thumb on things because I didn't know where my hand was in relation to objects. And I got so PO'd at myself because I would hit the end of my thumb like a jamming. And that's like, Mike, like you hitting the doorway going through it. I used to do that too, but I don't do that anymore. Now my body knows where it's at because I got enough treatment to make it aware, get the good blood flow back into it like it's supposed to have.
Well, there's another thing a lot of people have trouble with, and that is prescription blood pressure medicine, for example. You can't get up too quick from sitting without having dizziness.
That's
just got to take it slow.
Right. That's a condition called paroxysmal. What is that, Dr. Ware?
Well, it's
paroxysmal.
Yes, it's paroxysmal, but it's also called orthostatic hypotension. And there's other dizziness-related benign paroxysmal positional vertigo, or BPPV, or positional vertigo. And benign says it's not going to kill you unless you fall over. Paroxysmal, it comes and it goes. Positional, it depends on how your body is oriented in space. And vertigo, things are spinning.
So you just have to be careful not get up too fast, right?
Right. Now, we often see that in people who have their adrenal glands malfunctioning over a period of time. And what do you call that, Dr. Wyrick?
If the adrenal glands are not functioning, if you have adrenal fatigue, then that tends to cause hypotension. The blood flow, your body can't regulate the blood pressure, and if you suddenly stand up, the blood flow to your brain isn't sufficient, and so you more like faint. Whereas the BPPV is most often associated with a issue with what are called otoliths, or ear stones that are part of the vestibular system, the inner canal of the brain of the ear that acts like a carpenter's level, literally, to determine your position in space. And so there's special maneuvers that can help get the otoliths back where they belong, and sometimes it's also a blood flow issue.
Right. It's a type of adjustment on the neck bones and the skull bones. It was developed by a Dr. Epley, who's an osteopathic physician and surgeon. And I learned that technique, 60 years ago, I think. A good spinal adjustment on the cervical spine, plus cranial adjusting when indicated, almost 100% of the time takes care of that problem. I've done thousands of people taking care of their process, their imbalance with a good adjustment on the neck and on the skull. So that's benign paroxysmal positional vertigo. Also, you have the adrenal glands being wrung out from stress. And then there's another thing that's due to an infection or inflammation of the inner ear that causes dizziness and loss of balance. What's that called, Dr. Wyrick?
Labyrinthitis, where the labyrinth is, again, referring to the inner ear and the semilunar canal, and it's inflamed, often due to a virus.
And then there's another type called Meniere's syndrome or Meniere's disease.
Yes, it's more of a syndrome. We don't know exactly what causes it, but sometimes it responds to various treatments that we try.
Well, actually, I've found that niacin and other B vitamins are extremely important in this. But most important is getting good digestion of your foods so that you get all the right nutrients into your system. You got to have the right minerals. You got to have the right vitamins. You got to have the right what are those fatty molecules called, Dr. Weyrich?
Fatty molecules, like
called omega oils,
omega-3 oils,
and all those good things. You know?
And actually, cholesterol is very important for brain health as well.
It is, isn't it? So don't want to take things that cut your cholesterol down. So there's a nerve that comes out of the skull, up inside the skull, called a vestibular nerve, and it can become inflamed from a virus, it says. It is said to be. However, I find that most of these viruses are simply a lack of proper blood flow. And you get the proper blood flow going, and the virus just flushes right out, and everything starts working good again, especially when you stimulate the central nervous system, and it makes the immune system work normally in the body. And our human bodies are so blessed with a really great immune system. If we don't poison it with the bad food or damage to our bodies interfering with blood flow to the organs of the immune system. So, Dr. Weyrich, what is mal de debarquement syndrome? How about that for a good French word?
Okay, using my best French accent, mal de débarquement is a sickness of getting off a boat.
So after an ocean cruise,
yes,
or other sea travel, or even if you've been out here on Roosevelt Lake and had a little bit of a storm and the boat rocked a whole lot and you got a little bit sick, so you have seasickness. That's what that's called.
But it persists after you get back onto land.
Right, and almost always that's lack of B vitamins, lack of proper blood flow, and too much of the wrong kind of food in your intestinal tract.
And cruise ships are notorious for foods that people shouldn't really eat.
And too much of it also.
Yes.
So people aren't taking good care of themselves. It used to be on a cruise ship, people would eat properly and then they would run around on the deck to get their exercise. I don't think they've got people running around on the deck anymore like that. They've got these swimming pools, but they're very small and not a whole lot of exercises available unless a person is into exercise. And we humans are not into exercising like we used to be years ago. Mike, you used to run a lot.
Mm-hmm.
We don't see many runners around here, do we?
Oh, I do. A lot of people run up and down Tyler Parkway here every day, you know? But what do you mean? Not so many people are running anymore? Or is that what?
Well, we used to see people, walking fast, jogging,
right.
Instead of just sauntering. We would see them out there exercising, going someplace rapidly instead of just kind of moseying along.
Right.
So, as a human race, we've backed away from that quite a bit. Now, I do see on the 260 down in Star Valley, the people going to the exercise place down there. I see runners there all the time.
Mm-hmm.
But that's very few people out of the whole population. The numbers aren't there like they were when I was a kid.
Right. I don't think as many people are running as there used to be years ago. But that brings up a question. You were talking about seasickness. I've had some experience with that, and I have found that for me anyway, and I think a lot of people, if you just take your shoes off and you walk out on the deck and stand there and look at the horizon, you won't get seasick. It's hard to tell people that because they want to go and find the toilet and throw up. But, if you just stand and get get that balance going with the way the ship is moving and looking at the horizon. It really does help. And
That's...
Huh?
Go ahead and finish.
Well, the only other thing I was going to say is that having had a little bit of balance problem recently, I read that there are exercises you can do to help your balance, and I have found that, you very seldom do it, but if you just stand there on one foot for a while and have something else to grab in case you fall down, and then do that and look at a central point while you're doing it, and it's like an exercise. If you do it every day, I think it really does help your balance.
Oh, absolutely. But it's interesting that you mentioned taking off the shoes.
Yeah,
now, I have an explanation for that if it's a metal ship that has a metal deck. And that is, there's a concept called earthing, where having a physical connection of your feet to the earth, to the ground, and the ocean is a very good conductor down to the earth, it has many health benefits. It benefits jet lag and many other issues as well. So if it's a metal ship, it's very interesting that taking off your shoes gives you that benefit.
Well, I think there are a lot of benefits of being barefoot. You have a better feel for your balance.
Yes.
There's no shoe interfering with your senses that help your balance. I found it very helpful. But, the other thing is I found it's also helpful to do some of those exercises. And one of the things I do is when I'm brushing my teeth, I stand on one foot and see how long I can stand there like that,
And some people find that taking a sea cruise helps their low back pain. Because
really?
Yes, because if the deck is rolling, it's a gentle exercise that's strengthening the core muscles.
Okay.
Right. I think years ago they used to call that getting your sea legs.
Yeah, right.
Exactly. And it didn't matter if it was a metal deck or a wooden deck.
No.
It was getting your balance, getting yourself back into the flow. In the flow, yes. So, if you come in and see us for something in our clinic, Patient Health and Wellness Center, seeing Dr. Gear or Dr. Wyrick, you want to ask yourself these questions. And if you answer yes to any of these questions, then you really do need to come in and see us. And it is, do I feel unsteady? Do I feel as if the room is spinning around me, even for a very brief time? Do I feel as if I'm moving when I know I'm sitting or standing still? Do I lose my balance and fall? Do I feel as if I'm falling? Do I feel lightheaded or as if I might faint? Do I have blurred vision? Do I ever feel disoriented, losing my sense of time or location? So you can help us make that diagnosis if you give us that kind of information. And you want to describe your dizziness or your balance problem. And we might want to know if it's a spinning sensation, which way does the room spin, to the right or the left? Is the dizziness spinning caused by any specific motion, or does it occur even when sitting or lying still? Are there any other symptoms that occur at the same time as the dizziness or spinning, such as hearing loss or tinnitus, that's ringing in the ears, a feeling of pressure in one or both ears, or a headache? If it's a headache, what part of the head is hurting? The front, the back, the sides, the top, the bottom? Does anything seem to help the dizziness spinning? How often do I feel dizzy or have trouble keeping my balance? How long do the dizziness or spinning episodes last? Seconds, minutes, hours, days? Have I ever fallen? When did I fall? Where did I fall? Under what conditions did I fall? How often have I fallen? So that's all important stuff. If you're taking medicine, I need to know, or Dr. Wyrick needs to know, the prescription medications that you're taking, all the over-counter medicines, such as aspirin, antihistamines, or sleep aids, and all the vitamin supplements and alternative or homeopathic medicines. I've got a couple thousand homeopathic medicines in my office that I used to use a lot with patients. Back in December of 2017, last updated March 6th of 2018, was a report from the National Institutes of Health. And the brain plans movements. The middle frontal gyrus is listening. A brain-computer interface study reveals one brain region's surprising role in planning movements exclusively in response to sounds. Dr. Weyrich, you've done a tremendous amount of study in the brain and biofeedback mechanisms. There's part of that brain that has to work if you hear a sound that tells you where it's coming from and what you need to do.
Yes. And it probably is part of what's colloquially called the lizard brain, which processes emergency input and takes emergency action before we even think about it. And it does a lot of pattern recognition, both of visual and auditory inputs, and reacts very quickly.
It is very important. And if you don't have good blood flow, it doesn't react. And that blood flow is interfered with when your skull is sitting cattywampus on your neck. And you know what cattywampus is, Dr. Weyrich?
Well, it's where your block almost got knocked off, but not quite, and it's on crooked.
It's crooked, yeah. And so we look at that. And, you know, if you've had pictures made of yourself and you see that your head's always cocked to one side, or you're leaning your head to one side, or your face is turned always kind of to the right or kind of to the left, that means that you don't have good muscle, spine, nerve, joint function, and that probably equates to a circulation problem to the spinal cord and even the brain itself. So Brown University made that study, and experts have long suspected that dizziness and balance problems are often overlooked and untreated, but the scope of the problem wasn't fully understood, and that's why the National Institutes of Health supported the largest national survey to date to uncover information about these disorders in children. We've been talking about older people here, but in children now, get this, the study included data on nearly 11,000 kids ages 3 to 17. And that study is a recent study. Epidemiology and Dizziness and Balance Problems in Children in the United States, a population-based study. It was done in 2016 and published January the 23rd. Now, the researchers found that more than 1 in 20 kids in the U.S. had a dizziness or balance problem, and only 1/3 of them received treatment in the previous year. So the findings suggest that dizziness and balance problems are fairly common among children. And that was a statement made by Dr. James F. Batty, Jr., a pediatrician and director of National Institutes of Health's National Institute on Deafness and Other Communication Disorders. So how many children do we have in schools here in Payson? Mike, any idea?
No, I'm not really sure of
A few
what the
thousand?
number. I would say 2,000 would be a good guess.
And if it's 1 out of 20, how many kids does that mean have dizziness or balance problems?
About 100.
Mm-hmm.
So what's being done for those kids?
30% are perhaps being treated, although Payson is an underserved area, so we might not even be getting our 30% treated, and the rest are being neglected.
So in this article, they said exactly what we've known since we've been in practice. Our sense of balance is a complex process, and that's what you mentioned in the very beginning, Mike. It's managed by signals between the brain, ears, eyes, and sensors in the joints and other body parts. The intricate system helps your body monitor and maintain its position as you move throughout the day, without you even having to think about it. But if any of these many sensory signals go wrong, it can weaken your sense of balance. We've been talking about that this whole show, haven't we? Trying to help everybody out there understand that it's a problem they need to take care of. Balance disorders can make you stagger when walking. You might teeter or fall when trying to stand. Affected people might feel like they themselves or the world around them is spinning or moving, a condition known as vertigo. Other symptoms can include blurred vision, vomiting, diarrhea, confusion, and anxiety. How many children sitting in class are not paying attention because they've got a twisted neck and it's affecting the blood flow to their brain? You know, I took care of the children in the Sikh community in Phoenix for 1 year, and then the next year I took care of the children in the Catholic Church out in Buckeye, Arizona for a whole year, one week, one treatment a week, and the changes in those children was phenomenal, absolutely phenomenal. They became alive, they became awake. Their grades went up 1 full grade just by getting treatments on their spine, nothing else. It went from D's to C's, from C's to B's, and even quite a few B's went to A's because they began to think properly. So common causes of balance problems in children range from ear infections, severe headaches, and certain medications to more serious neurological disorders. Now get this, and this is coming from the National Institutes of Health and the study done on these children, head or neck injuries and genetic conditions. In many cases, the study's researchers found an underlying cause wasn't reported. How many of our children have neck injuries that we can fix?
How many of our children jump around and do wild, crazy things?
Exactly. And it's so easy to fix children, so quickly to fix children. So, unless a doctor is skilled in understanding structure, they're not going to pick up the balance disorders that are due to neck injuries. It just isn't part of their training. So they can be especially hard to diagnose in young children. Now, I diagnose it because I touch them. I feel the neck, I feel the tensions, I feel the muscles, I feel the bones. I can do that in newborn babies all the way up till a person's 100 years old or more. And it's so simple and so important.
Easy for you to say. My specialty is the chemistry involved, not the X-ray hands that I say that you have.
Well, it's a talent that I have all my life. I'm good at spatial orientation. So kids may not know the right words to describe their symptoms. Affected children may talk about a spinning feeling. They may say their tummy or head feels bad or weird. They may walk unsteadily or seem clumsy. How many children get the sign hung around their neck? They're just clumsy.
Or they have 2 left feet.
Yeah. It's terrible. So parents who notice dizziness or balance problems, or grandparents who notice it in the children, should consult us, because we want to rule out that it's a problem that can be fixed so easily. Bring your child to see us at Payson Health and Wellness Center to rule out the spine. You know, we don't even charge you for that exam, that complimentary consultation and physical exam of the children. Because it's so simple to do. And if we can fix it, we'll do it as quickly as we can, as economically as possible. So
Doctor, I have to say that people who are having problems with balance, sooner or later, it takes 1 or 2 falls before they realize they got a problem. You know what I mean? It's like, then when someone has a serious fall and they break their hip, they're in the hospital, they get pneumonia, and usually they pass away. I mean, this happens so often, I can't hardly believe it. So you've got to prevent the fall to start with.
Right.
And that's why if you're having a problem, like we're talking about, could be caused by a lot of different things, but probably in most cases it's being caused by a lack of blood flow to your brain.
Yes. And almost always that's due to these 2 issues that we've been discussing primarily, and that is a structural problem in the spine from old injuries, or a dietary problem where someone's digestive processes have gotten old and they don't digest their proteins properly. And so they now have become poisonous to them. Mike, you took the test. You went through it all. You looked what it's like to eat food you shouldn't eat and the reactions that you get from it.
Mm-hmm. I sure do.
And, you learned that you can't have vanilla.
Yeah, and, sometimes when you find out there's certain foods you can't have, they sneak up on you. I found vanilla was in a lot of the pills I was taking.
Yes, in fact, one of the primary
supplements.
digestive enzymes that I use with patients had vanilla in it, and you couldn't take it.
Right. And another thing is I'm really allergic to cornstarch, and most pills are formulated with cornstarch.
It's a great filler.
I'm going, what's going on? Why am I having so much problem? It's because of these things that you shouldn't be eating, shouldn't be put in your body. And, once you find out what they are, that test that I took was very beneficial. And I would recommend it to everyone, because it's not a matter of this is a bad food, this is a good food. Because what you consider maybe a good food, healthy, it might be causing you problems. Like for me, tomatoes. Who would think that tomatoes would not be good for you, right?
Well,
for me, they're not.
I know. I can't eat beef. I can't eat pork. I can't eat eggs. I can't eat pinto beans.
What can
it's
you
terrible.
eat?
Well, out of 154 foods, I can eat 140 foods.
Oh, well, that's not bad. You got something.
Yeah,
right.
Those foods are a lot of exotic things like rabbit and...
So I eat a lot of chicken. I eat a lot of fish. But mostly I eat a lot of vegetables, raw vegetables, a lot of salads.
But there's even vegetables that cause some people
Oh,
problems.
absolutely. You got to be careful. As you said, tomatoes.
Mm-hmm.
And gosh, there's so many other ones.
Yeah, somebody I know is allergic to broccoli.
Yeah, me. Yeah, but and I eat a lot of it. But you know what? Recently, I've reintroduced it in small amounts to my diet, and I haven't had a problem.
Well, you've got a lot healthier these days than what you used to
That
be.
might be too, but
That has a lot to do with
it changes.
Yeah.
I think it has a lot to do with whatever you eat a lot of is what you have a problem with.
The problem with it is this. There are genetic things that we're born with, and there are things that happen to us because of injuries in our body over the years. And so we can get rid of those things due to injuries when we fix the injuries. But the genetics stays with us a lifetime.
Although there is epigenetic techniques.
Oh, well, Dr. Wyrick, that's not here yet. It's coming, but it's not here yet.
It's coming real fast.
Well, are you going to do it?
I'm doing it.
With injections of DNA?
No.
No.
It's modifying the diet and so forth.
Okay. So you're doing it through oral modifications of diet and the testing that you're doing with your anti-aging.
Right. It's well known that the expression of genes is affected by the environment. And if we change the environment, we can affect how the genes are expressing.
I think that's called evolution, isn't it?
No. It's
Yes,
not
yes.
evolution.
Yes.
It's
That's how
turning
things
the
change.
genes on and off, not changing the genes.
Okay, well, it's part of the process. Okay, so at Patient Health and Wellness Center, we have Dr. Wyrick and myself. We are frickin' frack. What do you say about Jack Spratt? And
His wife, yes.
Yeah. And we take care of the structure and we take care of the chemistry. And we do it from a functional point of view. How does the body actually work? If you want drug therapy, and that's what you're interested in, we do not do that. But we do pretty good with structure and nutrition, supplementation, making the body work right. Now, we can do drugs if we have to. In fact, Sunday I wrote a prescription for amoxicillin because it's necessary once in a while.
and I specialize, or not specialize, but I do a lot of bioidentical hormone prescriptions, which are prescription drugs, but they are identical to the chemicals that the body makes on its own.
Exactly.
But there is not a drug for balance, is there?
No.
Well, not so fast. Various B vitamins are very important for nerve health, and so sometimes we have prescription vitamins that we use.
Okay.
Like we do vitamin B12 injections.
Right. That's nutritional supplementation that is used IV or IM, that's intravenous or intramuscular, and when it's used that way, it's called a drug. And when it's used for a specific purpose, it's called a drug. So, yeah, we could split hairs on the legal definitions of the word drug. So, Mike, it's been a great pleasure having you take care of us on this show this time. Thank you so much for running the whole thing and being a great moderator, and really appreciate being able to bring this information to the public.
Well, thank you for being here. I'm going to stand up right now and see if I don't fall over. Thanks to you. Anyway, we'll be back next Tuesday with another program. And if you'd like a copy of this, just go to KMOGcountry.com tomorrow and click on the link to the podcast for Dr. Gear's show.
That's wonderful. I hope everybody can do that and bring a friend.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.